Hello everyone, I am Dr. Shikhar Kumar, Consultant Medical Oncologist at Yashoda Hospitals, High-Tech City. We all know that breast cancer is the most common cancer in India, and it is estimated that 1 out of every 20 Indian women will develop breast cancer during her lifetime. Now we know that there are a subgroup of women, around 10 to 20% of women, who develop breast cancer because they have a defect in their DNA. That is, the most common genes which are responsible for this genetic cause of breast cancer are known as the breast cancer genes. The short form is BRCA gene, BRCA1 and BRCA2. So let us learn a little bit about genetic testing, when, why and how do we do it for breast cancer. Coming to when, any woman who was diagnosed with breast cancer at a young age, say less than 50 years of age, should undergo genetic testing for BRCA1 and BRCA2. Any woman who has been diagnosed with a particular subtype of breast cancer known as triple negative breast cancer, in which the ER, PR and HER2 hormone receptors are negative, this woman should also undergo genetic testing for BRCA1 and 2. If you don't have any of these factors, but if someone in the family has developed breast cancer at a younger age and you also are affected with breast cancer, then again you should be tested for this gene testing. That was about the when. Now coming to the why. Why is it important to test for BRCA1 and BRCA2 and the other genes? There are two implications of this test. The first implication is, if a cancer patient is diagnosed to have a defective gene in the genetic test, then it affects that patient's entire family. The patient's siblings, the patient's children need to be also tested, and we need to rule out that they are also carrying this defective DNA in their blood. This is known as cascade testing. The second thing is, if the patient has a positive report for any BRCA1 or BRCA2 genes, then the patient's treatment can get impacted, because now we have a new class of targeted therapy drugs known as PARP inhibitors, and the most common drug that is we use in these PARP inhibitors is known as olaparib. So this drug can come into the treatment paradigm for this patient, whether the patient has been diagnosed with a early stage cancer or the patient has been diagnosed with stage 4 cancer, which can help the patient's cure rate and which can help to improve the patient's lifespan. Coming to the last part of it, how do we do BRCA testing? That is very simple. It is done through a technology known as NGS, which is next generation sequencing. The patient's blood sample is taken and sent to a specialized laboratory where the DNA is analyzed, and we get the results within 2 to 3 weeks. It is very important that the patient do these tests only after consulting their oncologist, and the facility also has a in-house genetic counselor who will further be able to understand the patient's risk of having a defective DNA in their blood and be able to counsel the patient once the reports of the genetic testing are available. Thank you.